In this lecture, we will talk about lymphatic blockage. Lymphatic blockage is a cause of extracellular edema. But to understand lymphatic blockage is a cause of edema, we must first understand the factors that basically are involved in capillary filtration, or they can increase or decrease the capillary filtration. As we discussed in our last lecture, that there are four main important forces that are involved in the shift of fluid from the capillary lumen into the interstitium, and from the interstitium into the capillary lumen. Now, when the blood comes from the heart through the aorta, through the arteries, through the arterioles, and finally into the capillaries, at the level of capillaries, the exchange of fluid is going on. Some of the nutrients required for the oxidation metabolism are shifted from the capillary, from the lumen into the interstitium, where the cells they basically fulfill their needs. Some of the substances which are higher in concentration in the cells in the interstitium, the waste, they basically enter the lumen, and they are basically they are taken away, and the blood from the comes from the arterial side and basically goes towards the venous side and take the blood towards the heart. Now this cycle keeps on repeating, but exchange occur basically at the level of capillaries. Now we discussed previously that there are four main important factors, two from the capillary lumen and two in the interstitium. In the capillary lumen, the capillary hydrostatic pressure basically pushes the fluid outside the capillary. The capillary hydrostatic pressure basically pushes the fluid outside the capillary. The interstitial fluid, the interstitial hydrostatic fluid pressure basically pushes the fluid into the capillary. Then the plasma colloid osmotic pressure basically pulls the fluid. It pulls the fluid from the interstitium into the lumen of the capillary. And finally, the interstitial fluid colloid osmotic pressure, it basically pulls the fluid. It pulls the fluid from the capillary lumen into the interstitium. Now, in our last lecture, we discussed all these things in detail. In this lecture, we will just focus on the lymphatic blockage and the factor that basically will lead to edema that occurs in lymphatic blockage. We discussed that there is a capillary filtration coefficient, which is basically the product of permeability of the capillary. If this wall of the capillary is permeable, then the filtration will be high. And then this filtration coefficient also depends upon the area of the capillary wall or the vessel wall. If there is a large area, a bigger area, then the filtration will be high. If the area is small, then the filtration will be less. So capillary filtration coefficient is the product of permeability and area of the vessel. Then the other forces, they basically are summed in this equation. This PC is for basically capillary hydrostatic pressure. This PIF is the interstitial fluid pressure. This pi C is basically for the plasma colloid osmotic pressure. We can also write it as pi P, and then pi IF is basically for the interstitial fluid colloid osmotic pressure. We will basically focus on this interstitial fluid colloid osmotic pressure. Basically, the plasma colloid osmotic pressure is due to the proteins in the plasma inside the capillary lumen. This pressure, this force due to the proteins basically sucks the fluid into the capillary. And proteins in the interstitium, they basically pull the fluid into the interstitium. This force basically pulls the fluid into the interstitium, and this interstitial fluid colloid osmotic pressure is basically due to proteins in the interstitium. This colloid pressure is due to proteins in the plasma inside the capillary lumen. This colloid pressure is basically due to proteins in the interstitial fluid. What happens in the lymphatic blockage is lymphatic vessels, which are basically responsible for taking away large particles. So there are some large protein particles in the interstitium, the protein particles and the fat particles, which basically pulls the fluid out into the interstitium, and that is the colloid osmotic pressure, the interstitial fluid colloid osmotic pressure. Now these large particles, they cannot enter the lumen of the capillary. They are large, so they cannot enter the capillary. So basically the lymphatic vessels are responsible for transporting these large particles of proteins and fats. This lymphatic vessel is responsible for taking away the large particles, but these large particles, the proteins, the large molecule, the proteins, the fats, are in specific number in the interstitium, and normally they are taken with the help of these lymphatic vessels. But if lymphatic blockage occurs, if this vessel is blocked either due to any infection or carcinoma or cancer or any surgery or radiations, if any of these conditions basically blocks or destroys the lymphatic vessels, these vessels won't be able to transport the large particles, the large molecules of proteins and fats. They will basically accumulate in the interstitium. When they accumulate in the interstitium in large number, they will basically keep on pulling the fluid towards the interstitium. And a lot of fluid will collect in the interstitium. And this will lead to edema. As we discussed previously, that increase in capillary hydrostatic pressure can basically increase it interstitial fluid, and it can cause edema, because if this pressure is increased, a lot of fluid will go out and it will lead to edema. Decrease in this pressure, if this pressure is decreased, then less of the fluid will enter into the capillary lumen and edema will occur. Similarly, if the interstitial fluid colloid osmotic pressure increases, then this force will increase and a lot of fluid will come out into the interstitium. It will keep on accumulating in the interstitium and edema will occur due to lymphatic blockage. So this is the rationale, this is the reason why edema occurs in lymphatic blockage, and the cause of lymphatic blockage may be infection or carcinoma or surgery or radiation. So that's all about the edema due to lymphatic blockage. Thanks a lot for watching the video.